Good morning, everyone. This video will help you to know about patent ductus arteriosus, which is a congenital cardiac anomaly. I'm Saranya, Assistant Professor at Tripplum College of Nursing. Objectives: this video gives you the definition of patent ductus arteriosus, what is the function of ductus arteriosus, incidence of patent ductus arteriosus, causes, pathophysiology, clinical features, diagnostic evaluation, management, complications, and the nursing diagnosis that can be framed for patent ductus arteriosus. So the definition, patent ductus arteriosus is a persistent opening between the two major blood vessels leading from the heart, that is, from the aorta and the pulmonary artery. Between these two major blood vessels, there is an persistent opening between them. So what is the function of the patent ductus arteriosus or the ductus arteriosus? So the ductus arteriosus carries the blood from the lungs and it sends directly to the body. When a newborn breathes and begins to use the lungs, the ductus is no longer needed. So when the ductus, what happens? It carries a blood from the lungs and it sends to the whole body inside the heart. But the functional closure of this ductus arteriosus occurs by 10 to 15 hours and the permanent closure will be 5 to 7 days to few weeks. But if the opening is not closed and it persists, that is until the 2 to 3 weeks of age of a newborn, it becomes as a patent ductus arteriosus. So what is the incidences? It is twice more common in females as compared to the males. And patent ductus arteriosus is common in infants who weighs less than 1500 grams, that is below 1.5 kg. 5 to 10% of all congenital heart disease accounts of patent ductus arteriosus. What are the causes is not known, but genetic reasons may play a role. Patent ductus arteriosus is more common in premature babies and affects twice as girls as boys. So it is also common among the babies with neonatal respiratory distress syndrome, that is NRDS, and babies with genetic disorders like Down syndrome, and babies whose mothers has rubella during the pregnancy also affects with the patent ductus arteriosus. Types. There are four types. First one is the type A, that is clonical ductus with well-defined aortic ampulla and construction near the pulmonary artery end. That is the type A. Type B is very large type. Okay, it's like a window ductus with very short length. Next, type C is tubular ductus which is without constructions. Type D is a complex ductus which has multiple constructions. So there are four types: type A, type B, type C and D, that is clonical, window, tubular and complex. Coming to the pathophysiology, so because of the failure of closure of ductus arteriosus, there will be a shunting of blood from left to right. So high pressure aorta to the low pressure pulmonary artery. The shunting of blood from the aorta to the low pressure pulmonary artery, which increased blood flow to the pulmonary tree. So increased blood return to the left side of the heart. So the left ventricle's volume is overloaded. So there will be increased blood flow to the pulmonary tree, increased blood return to the left side of the heart. So volume loaded with left ventricles. Then clinical features. So premature infant or preterm infant have small patent ductus arteriosus is asymptomatic usually. But if a preterm infant having a large PDA, the child will show the features. Poor eating, which leads to poor growth, sweating with crying or eating, persistent fast breathing or breathlessness, easy tiring, rapid heart rate, growth retardation, easy fatigability. That is, the child will become fatigued easily. These are the clinical features of patent ductus arteriosus. Diagnostic evaluation. First, coming to the cardiac examination. Here you can see a systolic murmur or a continuous murmur at second and third intercostal space. Then, if the child is having a large patent ductus arteriosus, you can feel a diastolic crumble and a gallop sound, and the pulse will be bounding. Electrocardiogram shows usually normal with small patent ductus arteriosus, but in large patent ductus arteriosus you can see a left ventricular hypertrophy, left atrial dilatation. This will be the changes in the ECG with patent ductus. Coming to the chest X-ray, you can see the increased pulmonary vascularity with normal or increased heart size. Sometimes it may be normal or sometimes the heart size will be increased. Echocardiogram 2D, it shows the PDA visualization. You can visualize the PDA, and Doppler, the amount of blood across the PDA you can be visualized. Coming to the medical treatment, first comes the indomethacin, that is the prostaglandin inhibitor. That is, indomethacin helps in inhibiting the prostaglandin, which helps to close the patent ductus arteriosus. It is very effective in the preterm infants before age of 10 days. So the dose will be 0.2 mg per kg, repeated 3 times in intervals of 12 to 24 hours. So it is repeated 3 times in the interval of 12 to 24 hours. Next, coming to the surgical management. Surgical management usually done at the 6 months of age, that is by the lateral thoracotomy, that is PDA is being ligated. So the patent ductus arteriosus is being ligated. You can see in the pictures, you can see how it is ligated. Both are ligated. Coming to the nursing management, so you have to maintain the adequate cardiac output, reduce the increase in the pulmonary vascular resistance, maintain adequate levels of activity to the child, provide support for growth and development, maintain appropriate weight and height development or a growth chart. So these are the important nursing management has to be followed. Complications. The child may go for heart failure or endocarditis, that is inflammation and infection of the lining of the heart, pulmonary edema, fluid in the lungs, and pulmonary hypertension, that is high blood pressure in the blood vessels of the lungs. The child may face these complications. Coming to the nursing diagnosis, so I already discussed that the child may have decreased cardiac output, which is related to the cardiac malformation, impaired gas exchange related to pulmonary congestion, and activity intolerance related to imbalance between the oxygen consumption by the body. Then the growth and development may be delayed or altered, and imbalanced nutritional status less than the body requirements, and the child may be prone for infection related to decrease in the health status. These are the nursing diagnoses that can be framed for an patient with patent ductus arteriosus, where the nursing care can be improved and focused. So In this video, so far we have seen about the patent ductus arteriosus. What is the ductus arteriosus and what is their closure time, and when it has been comes as patent ductus arteriosus, and what are the changes that has been happening in the child's heart when there is a patent ductus arteriosus, and how what are the features and what is the management is being given to the child. And while the ductus arteriosus is an essential component in the fetal circulatory system, but when it fails to close in the stipulated time, it shows a significant morbidity, that is the incidence of patent ductus arteriosus as a congenital cardiac anomaly. So these are the essential points related to the patent ductus, and here the reference. Thank you.